Eileen O'Reilly here from Memorial Sloan-Kettering Cancer Center and Weill Medical College of Cornell. So the question is, should I have my pancreatic cancer tumor sequenced, and what are the implications of this? Well, I think this is a very topical question, and one that we're asked almost every day from patients and families. And I think this is clearly an emerging consideration. As of now, we don't know yet what the full implications of this are and whether it does alter treatment considerations. The ability to do this has improved dramatically in the last several years, both in terms of logistical considerations and in terms of cost. And in addition, there's been a change in thinking in the pancreas cancer world regarding not just obtaining an FNA to secure a diagnosis, but now beginning to think about having a core biopsy so that there is sufficient tissue to do various genomic or molecular analyses to help define treatment considerations. So for example, we do this on a somewhat routine basis for some clinical trials where there's a requirement of a certain marker for patients to be eligible. Outside of a clinical trial consideration, it's certainly experimental at this time, but can be done. The frequent genomic identifications that are found are the presence of a K-RAS mutation. However, this has been, traditionally very difficult to target, and a series of new approaches and indeed new drugs are beginning to look again at targeting RAS in pancreas cancer. Another implication of genomic testing is the identification of a BRCA mutation and the possibility that those patients may have selective sensitivity to platinum-based therapies, topo inhibitors, or experimental drugs called PARP inhibitors. So again, none of these are defined standard options, but like in many other solid tumors, we hope to identify validated biomarkers that may suggest that a certain treatment will have application for a given patient. And I think over the next several years, we're going to see this increasingly integrated into practice and really learn how to, one, analyze the wealth of information that emerges from genomic testing, and to learn how to integrate this into clinical decision making.